Hello and welcome everyone. My name is Charles-Emmanuel Côté, kinesiologist at the Cardiac Rehabilitation Center in Richardson Hospital, part of Centre-Ouest Central Montreal. And I'm here today to discuss a little bit with you about fall prevention. During our presentation today, we'll take a deeper look into what are the probable causes for fall, how we can prevent those causes, and how to react if ever we do fall. All right. So we do talk today about falling because for many reasons, in fact. So as you might have known, falling is a major risk for injury and for hospitalization. So that could down the line impact your independence and also impact your participation in the cardiac rehabilitation process. We do speak into cardiac clientele about risk of falling because science has shown us that cardiac conditions are more at risk of falling. And in all of that, well, falls can be prevented. So let's talk about it. We'll start today with a little case to try and identify the different causes of a fall. You'll see that the take-home message is usually that a fall often has more than one cause, and it's usually the compounding of many causes that lead to a fall. Let's start with a case here with Margaret, who's a 76-year-old who lives with a heart condition. She has been experiencing frequent dizziness since her heart attack. Because of the pandemic, she has been postponing surgery for her cataracts for some time. Yesterday, unfortunately, Margaret fell down some dimly lit stairs. I'm going to give you just a little second to try to identify the different causes in this situation that could explain or have led to the fall. Let's take a look together. So you see here in red and bold the different causes that could explain that fall. So first and foremost, Margaret is 76-year-old. Science has showed us that as you age and you get older, the risk of falling increases. Usually, balance skills starts to decline past 65-year-old, depending on how much physical activity you do. The fact that Margaret has a heart condition, people with heart condition are usually at a higher risk of falling, and we'll see a little bit later why. The fact that she's experiencing symptoms of dizziness can also be a possible cause in her fall. The fact that she has cataract that affect her sight is also a probable cause. We could even say that the fact she's been postponing the surgery could be another cause in there. And the fact that she used dimly lit stairs, there is some type of environment cause there and maybe a little bit of behavioral cause by taking the risk to get there. So we can identify different causes there. We can see that there are some that are more person-related factors. We can see that some are a little bit more behavior-related, while some are more environment-related. So these are the three main categories where we can classify the different causes that can lead to a fall. Let's get a little bit deeper on each of those topics. So first, with the person-related factors, as we said earlier, people with cardiac condition are at a risk of falling. It could be a combination of medication, of decline in physical capacity, but it has been shown that people with cardiac condition are more at risk of falling. As we said, medication, or the fact of taking many medication, what we call polypharmacy, has shown to increase the risk of falling. There are particular medication that can cause dizziness, sleepiness, or orthostatic hypotension. That's a fancy word to say that you get dizzy when you change position or when you stand up too fast, let's say. So especially in cardiac clientele, beta blockers are a medication that can cause those symptoms. So if you have a medication like metoprolol or bisoprolol in your medication list, you are affected a little bit by that risk. There is also the fact of decrease in motor capacity. If you have a decline in your strength or in your balance, well, the risk of you falling might be higher than they were before. And as it was the case with Margaret and her cataract, having an impaired vision is also a person-related factor that could increase your risk of falling. If you don't see well around you and see the obstacles and the environment, well, that could lead to a fall. We also have a hearing loss in those related factors. Because you kind of have somewhat of a disconnect with the environment if you can't hear properly. That might apply a little bit less in your house, but let's say when you're outside and you hear a little bit less of the action going on around you, you can be less prepared for a quick reaction to a certain event. Next, having diabetes has also been shown to increase the risk of falling, because one of the main consequences of long-term diabetes is a loss of sensitivity under the feet. So if you can feel less your environment through your feet, well, that can increase your risk. There are other conditions like peripheral vascular disease that also decrease your sensitivity around the feet that could increase your risk of falling. Malnutrition is also a known risk factor for falling. If ever you are not eating enough or your body doesn't have enough of certain elements, it could lead to a risk of falling, rather by having not enough energy or having your body not functioning as efficiently as it should. Those are there. And last but not least, in the person-related factors, we also have cognitive health issues. If we take, for example, dementia or other mild deficit that can, let's say, lower or impair your decision-taking and your capacity to make proper behavior choices in how you move around. Next, we had the behavior-related factors, which falls down into two categories. Either taking too much risk, as for example, rushing to go to the bathroom during the night, climbing on a chair or an unstable surface to change the light bulb, or as an example for Margaret, using dimly lit stairs. So yes, the environment is not well, but she decided to use those stairs. At the opposite, we also have the fact of avoiding too many activities in your lifestyle, which could down the line increase your risk. Because let's take, for example, people who avoid any outside walking during winter because there might be a risk of ice over a slippery surface. Well, you might get more deconditioned from that and increase your risk of falling over time by taking out many activities for an inflated perceived risk of falling. Next, anything environment related, things that can be controlled and are related to things surrounding us. So some examples, and you can probably make some, of course there's the banana peel, but that doesn't really happen often. But anything that's cluttering your home, obstacles, low furnitures, or boxes that are on the floor can make you tumble into it and increase your risk of falling. Having inadequate lighting in a room, or when you walk, let's say, outside during the night and there's not much lighting, can also increase your risk of falling. Walking on obstacles or on things that are hiding the surface, like dead leaves or having ice or snow or slippery liquid on the floor, can increase, of course, your risk of falling. Having a lack of non-slip surfaces in or out of your tub or shower in places where we know it's going to get wet and slippery, if you do not have those non-slip surfaces, the environment might be increasing your risk of falling. On top of those possible causes, there is also the potential risk for injury that is not necessarily the same in everyone. If you do fall, well, if you have a low bone density, you might be at higher risk of actually injuring yourself and having a fracture after that fall. Same thing with low muscle mass. If you have nice big muscle, they do act somewhat as a cushion, and you might be able to kind of fall a little bit better, to react a little bit faster to an actual fall. So not everybody is equal into the risk of getting injured from a fall. Now, what's most important to this talk is how can we actually prevent those falls? You'll see that the take-home message here is to try to identify the factors that are related to our condition or our environment and our behavior, and to try to counter them with the solutions that we'll be proposing over here. So related to medication, the first step that you should do is try to know a little bit better about your medication and their possible side effects. Do your medication increase your risk of falling, or your dizziness symptoms, or your sleepiness symptoms? The best way to do so is to educate a little bit yourself about medication, following up regularly with your doctor about your medication, and if ever you want to dig a little bit deeper, usually the most savant and accessible resource is your pharmacist. So don't hesitate to ask questions about your medication. Next, the orthostatic hypotension, or those standing up too fast situation where we get a little dizzy for a second. There is a way to counter that. First, if you are prone for those types of symptoms, avoiding a long and hot bath or shower is a good recommendation, because those will increase those symptoms by opening up more your vessels and making you more prone to get those symptoms. Then it's all about taking your time when you change position. Whether it's from lying to sitting, from sitting to standing, but even from bending down to getting upright, let's say when you tie your shoes or you're working on the floor, taking your time and doing those changes of position slowly and waiting for a little bit once you did change position before you go on with your next activity. The best example I can give to you where we are maybe more prone to those risks is when you get up at night to get to the bathroom. From a laying down position to a fully standing position, you should take a little pause sitting in between, taking a little second, and then going up, and not trying to rush then, but to make sure that you're feeling all right before you go on with your next action. Then, limiting your alcohol consumption is also recommended if you're prone to those types of symptoms, because while you're under the influence of alcohol, you're actually having a lower blood pressure, so you're more prone to getting those dizziness symptoms. Over time, alcohol can increase your blood pressure, but in the next hours after taking alcohol, you're more at risk, and sometimes your decision taking and your reaction time is also impaired. So making sure that you limit your alcohol consumption can be a good recommendation. Next, regarding sight, impaired or reduced vision. Having a regular follow-up with your optometrist or your ophthalmologist is recommended. Sight changes and usually doesn't get better with age, unfortunately. But the good news is that usually those eye exams are free for 65 years and older. So do contact your optometrist or your ophthalmologist to have a updated eyesight test. Then there is some condition where we have different type of glasses for different situation. Some for more close reading and some more from daily life. So make sure that you're wearing the right glasses for the right time. Let's say you were working on the computer with close-sighted glasses, and that you plan on going into your house and going around to do some chores. Well, make sure you make the switch. And a very easy recommendation, cleaning one's glasses regularly. Sometimes there can be kind of a little fog adding up there that can impair our vision. So making sure that our glasses are nice and clean is recommended to keep your sight on its best behavior. Next, the decline in motor capacities. Well, you're definitely in the right place to do that, and that's why we do use physical activity and exercise to counter those loss in strength, in motor capacity, and in balance. So cardiac rehab is the perfect place for that, and we kinesiologists and physiotherapists are there to choose the right exercises for you, which usually go through working onto your balance and strengthening the lower body so you can get sturdier and more stable on your legs. Having a little bit of upper body is not bad too, especially in a case where you're using, let's say, a walking aid. Well, you're going to be a little bit stronger and using your walking aid more efficiently if all of your body is stronger. Then on the nutrition side of things, we do have a dietitian in the program. So if you have any concerns about not eating enough or not eating right, feel free to tell us about it and to inquire about her. All of our participants get the chance to meet with the dietitian. Next up, home environment. That's where most of falls happen, unfortunately. So at home, the best recommendation is to try to have non-slip and well-fixed surfaces. So if you have loose carpets at home or uneven or slippery floor, well, try to fix that or to be aware of those zones so you can be more careful when you get there. Then, having a clutter-free environment, as we said earlier, well, less risk to tumble into stuff if your environment is clutter-free. So make sure to clear your space and maybe put those low furniture that can be sometimes outside of your eyesight in more in corners and places where you walk less often. Having stable furniture of appropriate height can be good for two things. If ever you need to hold on to something, well, having a steady furniture or stable furniture, you'll get a good hold on there. And for, let's say, chairs or a bed, if they're not at the appropriate height, let's say you need to throw yourself on your bed because it's too high, or you need to kind of take a drop when you get off your bed, well, you might be increasing your risk. So making sure that chairs, bed, and the different furniture are of an appropriate height is recommended to reduce your risk of falling. Then, being in an environment where there is sufficient light is recommended. So those tainted lights might not always be the best when you walk around your house. So you want to be aware and to have a good eyesight on what's going on in your room. At the opposite, we do have people with glaucoma and cataract that can be a little bit more affected by glares. So of course, we don't want to have a shining bright light everywhere that could cause us to be blinded. And for those people with those eye condition, taking the habit of wearing shades outside when it's sunny can help to reduce the chances of glaring and being blinded by the situation. Especially in winter when you get that nice white coat of snow that reflects the light. Don't forget to wear your sunshades even in the winter if it's sunny. Last but not least, how can we have safer behaviors to reduce our risk of falling? Good examples of that is, as we gave the example of rushing to the bathroom, well, avoiding to rush to the bathroom is recommended. We know that having a leak is somewhat of a shameful situation at times, but it's always better than going too fast and actually falling. If you do have regular leaks, which is unfortunately more and more common in men and women as we get older, well, there are some solutions, either like wearing pads, or if you want to go and really work on that problem, you can ask your doctor, and there exists some program where you can work on your pelvic muscle training to try to lower your risk of having some leaks and to better control those leaks. Then, if it was recommended for you to use a walking aid, well, do use it. This is there to help you and to make you safer so you can keep on going with your daily activities rather than avoiding them and getting more deconditioned from it. Then, if you want to walk outside and you're feeling a little bit unsteady, well, there are a lot of different cleats that are addables to your shoes or simply shoes with nice cleats on it. You can visit usually a pharmacy and find some add-on cleats for winter. This way, you're a little bit safer, and if you do ever come across a more slippery sidewalk, well, you'll be well prepared. Then you need to be wearing some well-fitting shoes and hopefully some non-slip soles, and that can apply even for when you're walking inside your home. If you walk in socks inside your home, well, socks are slippery, unfortunately. There exist socks with non-slip soles also, but it could be a good idea to have a little bit of a better support for your feet, and having some non-slip soles even when you're walking inside is recommended. Then, if ever you do have to take some risk, well, try to mitigate the risk. Let's say for getting up in the air, well, try to use a stable step ladder to reach high objects. And if you're not comfortable for it, don't hesitate to ask for help. Don't put yourself at risk for a bulb change while you could fall and break a hip and impair the rest of your life for a light bulb. That would be somewhat not the best decision taking. Then I'm going to preach for my parish, of course, participating in the cardiac rehab program. Well, we're there to assess your needs and to customize the exercise prescription and the physical activity prescription to help you make better decisions and to be fitter and more sturdy on your feet. If ever you do fall, it's good to know how to react in case of a fall and have some contingency plans. So having an accessible phone, if ever you fell on the ground and you can't get back up, if there's no phone that are accessible or your landline phone is on top of a furniture, you might have a hard time accessing it. Having a cell phone always on you is a good way to solve that. Otherwise, there are some more sophisticated solutions to have some contingency in those situations. There exists different type of emergency button that you can have on the wrist or around your neck that you can press the button to call for help if ever you did fall, or even more technological system that can actually detect if you fall and call for help themselves. I think like the Apple Watch is doing something similar like that. Then, if you do fall on the floor, well, learning how and when to get up from a fall before you get into that situation can be a good recommendation. So we can be a little bit stunned when we fall. Is it always a good idea to get up or not? Should I call for help? Should I try myself? Well, at least learning how to appropriately get yourself up from the floor can be learned prior to a situation like this. So feel free, if you have concern about that, to ask our therapist, either the kinesiologist or the physiotherapist, on the best technique to get yourself off the floor. In conclusion, all of the tips that were provided in this capsule are there for you to stay safe and hopefully without avoiding your exercise or your daily activities, because we saw that this could also be an increased risk over time if you avoid too much activities. And I mean, let's be honest, it sucks to try to avoid our significant activities if we like those activities. Then, if ever you are concerned about falling, or that you feel like you're avoiding certain activities because you're worried you might fall, if you lack confidence in your balance, or you have any questions about fall prevention, we are there for you. So don't hesitate to come to us and ask a little bit more. And our physiotherapist can also assess your risk of falling and make some personalized recommendation for you. And if ever you want to know a little bit more, here's a pretty great resource from Santé Montréal, a website where you can dig in a little bit deeper about fall prevention in seniors. So Charles, closing up for you today. So I hope you learned something good and that you'll be able to apply, and don't hesitate to come to us for any questions. Here are other resources. When I say science told us so, those are the different studies that we based this presentation on. So you guys have a nice day, and I hope to see you guys around. Bye-bye.